Hi and welcome to your own Vet Online Academy Veterinary Wizard. Today we are going to tell you about a very important topic: vaccination in dogs. As you know that long association with humans has led dogs to be uniquely attuned to human behavior. So for security of both humans and dogs they must be vaccinated. Let's start with what is vaccine. So vaccine is a preparation, or it's better to say biological preparation, that provides active immunity against a particular disease. Vaccines are of different types, but we are not going in detail of them. Some vaccines contain an agent that is similar to disease-causing organism. Sometimes it is made from weakened or killed microbes, its toxins, or its specific proteins. Now what is vaccination? Vaccination is basically administration of a vaccine to help the immune system develop protection from a disease. Specifically, we are talking about the dog vaccination. First of all, we should know what vaccine should an adult or puppy needs. There are a number of diseases that causes illness in dogs. Sometimes it becomes confusing that which diseases are optional and which one is compulsory. So here is a list of diseases that are very common in the dogs and they need vaccination for them. First of all is kennel cough, and its primary cause is Bordetella bronchoseptica. This is highly infectious bacterium disease that causes fits of coughing, whooping, vomiting, and in rare cases seizures and death. Second disease is canine distemper. It is a severe and contagious disease caused by a virus that attacks the respiratory, gastrointestinal tract, and nervous systems of dogs, raccoons, skunks, and other animals. It causes discharges from the eyes and nose, fever, coughing, vomiting, diarrhea, seizures, twitching, paralysis, and often, death. This disease used to be known as hard pad, because it causes the foot pad to thicken and harden. Next is infectious canine hepatitis. Infectious canine hepatitis is a highly contagious viral infection that affects the liver, kidneys, spleen, lungs, and the eyes of the affected dog. Symptoms range from a slight fever and congestion of the mucous membranes to vomiting, jaundice, stomach enlargement, and pain around the liver. Fourth one is canine para-influenza. It is one of several viruses that can contribute to kennel cough. Fifth one is canine parvovirus. Parvo is a highly contagious virus that affects all dogs, but unvaccinated dogs and puppies less than 4 months of age are at the most risk. The virus attacks the gastrointestinal system and creates a loss of appetite, vomiting, fever, and often severe, bloody diarrhea. If you want to know more about this disease, click on the link above in suggestions. Next one is heartworm. When your puppy is around 12 to 16 weeks, talk to your vet about starting a heartworm preventive. Though there is no vaccine for this condition, it is preventable with regular medication that your veterinarian will prescribe. Seventh one is leptospirosis. Leptospirosis is caused by bacteria, and some dogs may show no symptoms at all. When symptoms do appear, they can include fever, vomiting, abdominal pain, diarrhea, loss of appetite, severe weakness and lethargy, stiffness, jaundice, muscle pain, infertility, and kidney failure. Eighth is the Lyme's disease. Lyme disease, or borreliosis, is an infectious, tick-borne disease caused by a type of bacteria called a spirochete. Transmitted via ticks, an infected dog often starts limping. His lymph nodes swell, his temperature rises, and he stops eating. This disease can affect his heart, kidney, and joints, among other things, or lead to neurological disorders if left untreated. Next one is coronavirus. The canine coronavirus is not the same virus that causes COVID-19 in people. COVID-19 is not thought to be a health threat to dogs, and there is no evidence it makes dogs sick. Canine coronavirus usually affects dogs' gastrointestinal systems, though it can also cause respiratory infections. Signs include most GI symptoms, including loss of appetite, vomiting, and diarrhea. Last but not the least is the rabies. Rabies is a viral disease of mammals that invades the central nervous system, causing headache, anxiety, hallucinations, excessive drooling, fear of water, paralysis, and death. It is most often transmitted through the bite of a rabid animal. So this was a little bit about the diseases that are common in dogs. Let's move towards our main topic: vaccination schedule in dogs. The first thing to know is that there is not just one puppy vaccination schedule for all dogs. There are many factors such as which part of the country you live in, and your dog's individual risk factors. Some dogs do not need every vaccine. This decision is between you and your veterinarian. Keep in mind before vaccination your animal should be dewormed. There are different schedule for puppy and adult dog, but we will discuss a general pattern. So here in this table you can see that according to American Kennel Club, puppies age with different vaccines are mentioned. Some are optional and others are recommended. At the age of 6 to 8 weeks, puppy should be vaccinated against canine parvovirus and canine distemper virus. An optional vaccines is Bordetella vaccine. At the age of 10 to 12 weeks, puppy should be vaccinated against DHPP vaccine. That is vaccine for canine distemper, canine hepatitis, para-influenza, and parvovirus. With optional vaccine of influenza, leptospirosis, Bordetella, Lyme disease. Per lifestyle as recommended by veterinarian. At the age of 12 to 16 weeks, DHPP and rabies is recommended, with same optional vaccine as 10 to 12 weeks. After that, at the age of 16 to 18 weeks, DHPP and rabies is recommended. An optional vaccine that can be done are coronavirus, leptospirosis, Bordetella and Lyme disease. And at last is to repeat DHPP and rabies annually, with optional vaccine canine influenza, coronavirus, leptospirosis, Bordetella, Lyme disease per lifestyle. This was a general schedule that is followed according to American Kennel Club. Now I will specifically talk about the schedule that is followed in Pakistan. First I will tell you the vaccination schedule of puppy. So there are two categories of puppies that are from vaccinated bitch, and those whose mother was not vaccinated. At the age of 6 weeks, unvaccinated bitch pup is vaccinated for canine parvovirus, but vaccinated bitch pup is not vaccinated. At age of 9 weeks, both unvaccinated and vaccinated bitch pups are vaccinated against canine parvovirus. After that, at the age of 12 and 16 weeks, both pups are vaccinated against DHPP2LR or hexadog. And then annual booster is repeated of DHPP2LR or hexadog. Here I have used DHPP2LR many times. If you want to know what is it, watch this video till end. So this was schedule of puppy. Now let's move toward adult dog vaccination schedule. At the age of 12 to 16 weeks, adult dog is vaccinated with DHPP2LR or hexadog. Then after 3 weeks its shot is repeated. And after then hexadog or DHPP2LR vaccine is repeated annually. This was all about vaccination schedule of puppy and adults. Now I am going to tell you some name of vaccines and their immunity against diseases. There are 5 combinations of vaccine that are used in Pakistan. So the first one is Rabizin, it has immunity against rabies disease. Second one is the Primodog and it has immunity against parvovirus disease. Third one is Hexadog and it has immunity against parvovirus, distemper, infectious canine hepatitis, rabies, Leptospira canicola, and Leptospira icterohemorrhagiae. Fourth one is Eurecan DHPPI2L. And this vaccine has immunity against canine parvovirus, canine distemper, infectious canine hepatitis, canine para-influenza virus, leptospirosis, and infectious laryngotracheitis. And fifth one or the last one is Eurecan DHPPI2LR. And this vaccine has immunity against canine parvovirus, canine distemper, infectious canine hepatitis, canine para-influenza virus, leptospirosis, infectious laryngotracheitis, and rabies. So this was all about dog vaccinations. I hope so you have learned something from this video. Wait a second. I forgot to tell you about DHPPI2LR. Basically it is a combination of vaccine of canine parvovirus, canine distemper, infectious canine hepatitis, canine para-influenza virus, leptospirosis, infectious laryngotracheitis, and rabies. That's all for today. Hope so you have liked the video. Kindly subscribe our channel and press the bell icon for updates. Thank you very much. And if you have any questions, do mention in comment section.